Good afternoon. I'm glad you found us. I'd like to talk a little bit in this clip about eustachian tube and eustachian tube dysfunction. The eustachian tube is the ear's natural ventilation channel to the outside world, allowing the ear to keep its inner ear pressure regulated so that we don't feel pain, pressure, or have fluid buildup in the ear. Fluid buildup in the ear can lead to ear infections and hearing loss. However, more common than that is simple pressure dysregulation, where we have basically pressure being different inside the ear than it is in the atmosphere, giving us pain in the ear, pain in the jaw, and sometimes pain in the upper part of the neck and throat. This ear pressure dysregulation can happen if the eustachian tube is too tight and stays wound too tight and does not open up and allow for good ventilation. There's several active muscles involved in actually snapping the eustachian tube open and allowing for this ventilation to happen. Every time we swallow, yawn, or move our jaw certain ways, the muscles activate and they allow the eustachian tube to open. Sometimes we can have swelling at the eustachian tube or perhaps poor development of those muscles that allow the eustachian tube to stay closed instead. In the more severe cases, the eustachian tube is completely closed and never really opens. In this case, patients always end up with an ear infection and fluid draining from the ears. In more mild cases, however, we can have basically just the development of too much ear pressure throughout the day or be very sensitive to ear pressure changes when riding on elevators, driving through the mountains, or flying on airplanes. Up until recently, the only solutions we've had have been basically to try to treat allergies in the nose, which really doesn't have much scientific evidence to actually work. And our other solution is the other end of the spectrum, where we essentially bypass the eustachian tube by placing a small ear tube in the eardrum, which requires a small medical procedure and can damage the eardrum and can actually worsen some other aspects of hearing. However, the last couple of years, the FDA has approved medical devices and techniques that allow us to directly treat that eustachian tube dysfunction, essentially with balloon catheters. So just like we have catheters that can dilate occluded coronary blood vessels, we can actually visualize that eustachian tube opening and pass a small balloon dilator through the eustachian tube and dilate those narrow portions of the eustachian tube that we think are contributing to obstruction in the symptoms. We've seen a lot of good success in patients with mild and moderate eustachian tube complaints and symptoms, and these were patients who really weren't treated very well previously. These patients often would complain of ear pressure, ear pain, but would still continue to have normal hearing tests, normal hearing function, normal balance, etc., and a normal physical ear exam. However, with eustachian tube dilation that we can do now and finally get that eustachian tube working better, we're seeing a lot better success and results. I'm very hopeful that over the next few years these techniques will evolve more and more, and we can do even more treatments to the eustachian tube to treat other conditions such as patchless eustachian tube dysfunction and other forms of middle ear pathology. I'd love to talk to you about this one day if you'd like to make an appointment in our office with myself or one of my partners. We're all very well versed on these new techniques.